Imagining the images, lumbar neuroaxial ultrasonography. In this educational video, we'll describe a learning technique called mental imagery for learning and remembering ultrasound images. We'll use the help of neuroaxial anatomy to demonstrate and understand the mental imagery technique. Vice versa, this technique will help us to learn the ultrasound images more easily. Produced by Nessil Çoşkınfra, MD, Akdeniz University Hospital, Anesthesiology and Reanimation, Antalya, Turkey. Contribution by İlker Onguç Aycan. Mental imagery is a well-assessed learning method and a memory technique. Mental imagery involves constructing mental images and has been shown to effectively help students retain and recall information. A growing body of evidence shows that mental imagery can accelerate learning and improve performance of all sorts of skills. Mental imagery is very popular among athletes and coaches and has been described as a centre pillar of applied sport psychology. Imagination is a good technique for rehearsal, for performance, dancers, athletes and musicians. Going through the motions or mentally rehearsing the movements in the mind is just as effective as physical training. Whatever you name it, the imagining method may be a perfect way of learning neuroaxial ultrasonography. The bones create acoustic shadowings in the ultrasound, and these shadowings can create some patterns. Images in neuroaxial ultrasonography mostly depend on pattern recognition, and it is very helpful to use the patterns to learn the images in neuroaxial ultrasonography. We may use mental imagery to learn and remember, to determine the midline, to identify the best interspace to work, to identify the ideal insertion point with clearest sonnet anatomy, and to determine the depth of the epidural space or dura more easily. By using mental imagery, we may also learn how to estimate the angle of insertion and identify any abnormalities of the anatomy. To perform this technique, you need to have the ability to imagine. To perform the mental imagery technique, you watch the technique from a senior, or you watch an educational video, or you read the books and journals, etc. Step 2. You imagine you're doing the same things you read or watched. Imagine the position of the patient, imagine how you place the probe, imagine the image you want to recognize and the patterns. Step 3. Imagine how the patient will be grateful to you. Neuroaxial ultrasonography. First thing first, anatomy. In the neuroaxial ultrasonography, we're looking for bony structures. 3 structures to know are spinous process, articular process, and transverse process. You have to imagine that spinal process is extremely superficial, and in the midline, an articular process is slightly more caudal and deeper, and transverse process is deeper than the spinous and articular processes. So these structures are located on an oblique line, and they appear at different times and different locations and different depths. We are looking for the posterior complex, which is made up of the ligamentum flavum and posterior dura, and the anterior complex, which is essentially the vertebral body and anterior dura. We use the probe in the sagittal plane for level identification, longitudinal approach, where the midline or paramedian identifies the sacrum and the lumbar. When you work on a sagittal plane, you can imagine 3 lines. Line 1 is located extremely superficially and passes through the spinal processes. Line 2, moving your probe very slowly laterally, you have a continuous line that passes through the articular processes. You are jumping from one vertebra to other vertebra. You are jumping from inferior articular process to superior articular process. When you are doing an epidural or spinal, it is extremely important to identify the level where you are supposed to work. At the sacral L5 level, you identify the long convex, white hypoechoic curvilinear structure, which is characteristic of the sacrum. And above, you distinguish short convex appearance of L5 lamina. A distinguishing feature of the L5 lamina is its short superior-inferior width compared with the other lumbar vertebrae. View of the L5 lamina and the overlying corresponding interspaces gives the typical sawtooth pattern. The center of the probe correlates to L5-S1 interspace, and the junction of the L5 and sacrum provides the reference for identifying the other levels. Deep to the lamina, we see the hypoechoic appearances of the ligamentum flavum and posterior dura, and we have the camel sign and horseback sign. To obtain the best view, you go slightly lateral to midline and medial to the sacral hiatus from line 1 to line 2, and angle in slightly and direct the probe towards the spinal cord. Here you get a better acoustic window. The ligamentum flavum, posterior epidural space, posterior dura, and intrathecal space are visible between laminae. These cannot always be distinguished from one another and may appear as a single hypoechoic structure, the posterior complex. Deep to the intrathecal space lies the anterior dura, anterior epidural space. These usually appear as a single hypoechoic structure, the anterior complex. When we put our probe very laterally, we have a discontinuous line with bony and muscular structures. With our ultrasonography beam, most of the time we will see three of the transverse processes. The erector spinae muscle lies superficial to the transverse processes. Between the acoustic shadow of the transverse process, we will have the acoustic window with the psoas muscle. At this level, the pattern is called trident sign. For identification of the midline, we turn our probe horizontally. We cannot always feel the spinous process, which can happen in obesity, but we can always see the spinal process because it is close to the skin and very easy to see. There are three lines and there are a few patterns which we have to learn in transverse plane. Line 1 passes from spinous process. Transverse approach at the tip of the spinous process easily identifies the midline of the spine. The tip of the spinous process and the lamina are brightly hypoechoic on ultrasound with pronounced acoustic shadowing that obscures all deeper structures. A symmetrical image of the two erector spine muscles are at each side. The characteristic pattern for spinal process in the midline is cone sign. When you move a little bit caudally from the spinous process level, we have no more spinous processes. Line 2 is just passing from the superior articular processes of the lower and inferior articular processes of the upper vertebra. Line 3, moving your probe very slightly caudally, you will recognize the junction between the articular process and transverse process. At these two levels, you are just in between the two spinous processes, and the beam doesn't hit any of the bony structures in the middle. Ultrasonography beam is passing between the two articular processes and or the transverse processes, which are located at the sides, and you'll see that you have two angles. In the transverse interlaminar view of the lumbar spine, the intrathecal space is a dark hypoechoic band sandwiched between the hypoechoic posterior and anterior complex. The ligamentum flavum, posterior epidural space, and the dura often can be distinguished in transverse plane, and we get the very characteristic bat sign or equal sign at these levels. The insertion point is determined by the intersection of the extensions of the two marks on the skin in the vertical and horizontal planes, one for the midline, the other for the interspace. The cephalid angulation required to enter the interlaminar space can also be estimated from the degree of probe tilt required to obtain an optimal transverse interlaminar view. Dural depth and the anterior-posterior diameter of the dural sac can be estimated by ultrasound with the aid of the built-in caliper. Remember the start area of skiing races? We see the best ski racers in the world with their head down and eyes closed, moving their heads and their bodies. They are all doing mental imagery. They are seeing and feeling themselves race to get prepared mentally to ski faster and to perform their best. In conclusion, do you want to improve your learning? Do you want to memorize more easily? You need to just imagine.
Imagine there's no countries. It isn't hard to do. Nothing to kill or die for. And no religion too.